Good morning. This is Dr. McDaniel at GYN Corner. I'm a board-certified obstetrician gynecologist in New York City, Midtown Manhattan, and I'm bringing to you all things health-related for women. Thank you for joining me today at GYN Corner. And as the title stated, we are still speaking about thyroid disorders, thyroid diseases. Today's topic is Graves' disease. Graves' disease appropriately was discovered and initially diagnosed and presented to the world in 1835, so not very long ago. Was that a little over 100 years ago? So maybe a little bit of time now, almost 200 years ago, by a Dr. Graves, an Irish doctor, who first presented the manifestation of Graves' disease. And Graves' disease is a manifestation of an overactive thyroid or a hyperthyroid disorder. So as I mentioned previously, the thyroid is a small gland. It's butterfly shaped and it lies right at the base of the throat. So it has a middle portion there like the body of a butterfly, and then on each side of the neck are the wings. And the thyroid is predominantly responsible for metabolism, for regulation of weight and regulation of body temperature in our bodies. So the thyroid can be overactive, which means there's too much of the hormone being produced, so there's deregulation of the body's metabolism and temperature control, or it can be underactive, where the deregulation means that nothing's being done. And with the overactive thyroid or a hyperthyroid disorder, everything is in overdrive. So I'm going to say the predominant manifestation is someone comes in with an unexplained weight loss and feeling jittery, like they just had 5 cups of espresso. And a lot of people will feel like their heart's pounding or like they're skipping beats or so, and that's because their heart is pounding and they are skipping beats. So most commonly it's going to be an anxious, nervous feeling, increased heart rate. They're going to be jittery, so hand tremors. A lot of times increased sweating because of the temperature regulation issues, and they'll also have decreased sleep, same as if someone had the 5 cups of espresso. So decreased sleep, and the bowel motility is increased, so there'll be loose stools or frequent stools or diarrhea. As I mentioned, the weight loss, and then there's also going to be menstrual irregularities. So hyperthyroid disorder causes usually frequent cycles or longer cycles than normal, or heavier cycles than normal, and irregular ovulation pattern due to the increased thyroid activity, and also a manifestation that if you're at least around in your 50s to 60s or older, you'll remember that the first President Bush, George Bush, his wife Barbara, she had Graves' disease when they were in the office, and she had the bulging eyes. So they used to call it the thyroid stare. So it's like, so if you can see someone looking at you, and all around the dark area, the colored area of the eyes, the retina, all around that you can see white. So thyroid stare, and they're not staring, they're not trying to look buck-eyed, is because their eyeballs are protruding because of the Graves' disorder. So Barbara Bush had that when President George was in the office, the dad. So everyone around that time learned, I feel like that was the 80s. Everyone around that time learned a bit about Graves' disease because it was a big, of course, national media phenomenon that the president's wife had Graves' disease. So those are usually the manifestations. The patients will often come in because of all that discomfort and all of those symptoms, or people noticing that their eyes are bulging, or start noticing that it looks like they're losing weight and they're not doing anything to do it. What's their secret? So the signs and the symptoms are pretty classic, and The Graves' disease is the most common reason for an overactive or hyperthyroid disease manifestation. It's the most common. Around the world is basically the same reflection as we have here in the States. So it affects women more than men, about 7 to 8 times more frequently in women. It usually affects middle-aged women, so 40s to 50s. Excuse me, or after pregnancy, or after some kind of inciting event, stressful event, good or bad, or a flu or viral disease usually will exacerbate the presentation of Graves' disease for some people. Tends to run in families who have a history of autoimmune disorders like diabetes, type 1 diabetes or juvenile diabetes, rheumatoid arthritis, lupus, so the usual autoimmune disorders that tend to run in families. Sjogren's is another one. And it affects approximately 3 to 5% of the population at any given time, or you could say 1 in, the numbers vary, so like 1 in every 10,000 or so people will have Graves' disorder or Graves' disease. Now, Graves' disease, like Hashimoto's, which I presented previously, Graves' disease is also an autoimmune disorder, an autoimmune disease. In Hashimoto's, the body is attacking the thyroid and it's destroying the thyroid, so that presents predominantly with low thyroid, underactive thyroid, hypothyroid disorder, whereas in Graves' disease, the body produces proteins or antibodies to attack the thyroid, but those antibodies are mistakenly seen. They look like the proteins that increase the thyroid, that tell the brain to increase thyroid function. So it's a bit of a cross reactivity or cross signal. So the antibodies kind of are mistaken when they attack the thyroid, mistaken for the hormone that tells the thyroid to overproduce, to increase its activity. So the body mistakenly tells the thyroid to increase its activity, and we get hyperactivity of the thyroid with all of those manifestations. Sorry, I've had a weird cough this week. So the manifestation is hyperactivity. The diagnosis is similar to the diagnosis evaluation that we do for any thyroid disorder. It's always the same. An evaluation starts with the exam to see if there's just a single lump, a goiter, a nodule, or if it's diffusely, the thyroid is just diffusely enlarged. And for Graves' disease, it will usually just be the whole thyroid is ballooned up, grossly enlarged, because the entire thyroid is overacting. It's on overdrive, producing the hormones at a high rate. And then we always draw bloods to see if the thyroid activity is due to the usual hormones just at too high of a levels, and that's always going to be the case. And then if it's suspected that there's a Graves' disease that's just the thyroid's ballooned up, you have low levels of the brain TSH, and then you have high levels of the thyroid T4, T3, then most people will check for antibodies, thyroid antibodies. Those will usually be positive because it's an autoimmune disorder, so there's abnormal antibodies. And then most people will get a sonogram to confirm that there's just diffuse thickening of the thyroid. There isn't any liquid changes, cystic changes, or specific nodules. And then for the Graves' disease, a lot of physicians will add a thyroid uptake scan. So it's a scan that's done to see the thyroid uses iodine to produce its hormones. So radioactive iodine is given to the individual, and then the thyroid is scanned to see how that iodine is picked up and the rate at which it's picked up. Because the thyroid is overactive, the iodine should be picked up very quickly, and it should be diffusely picked up or diffusely highlighted on the scan. So that's a radioactive iodine uptake scan is what's done. And that pretty much stops there with the diagnosis. most individuals don't need a biopsy unless there's a specific abnormal lump or area that's enlarged. And the treatment can be several different types. So the first line of treatment for most individuals will be medication, and it's a medication to fight the thyroid. So it's an anti-thyroid medication. Others will do radiation, and then occasionally or rarely it's surgery. So I'm going to stop right there today because I've been going on for a while now about Graves' disease. It's a lot of information. I try to distill it down to a small amount so that's palatable. But I'm going to stop there with Graves' disease, and then I'll continue at the next presentation to finish off on the treatment, the management, and then go in a little bit more detail about the disorder. So I hope that's been helpful information on Graves' disease, the most common reason for an overactive thyroid. This is Dr. McDaniel at GYN Corner. Please hit the follow button and the like buttons on Facebook if you enjoy the information I'm presenting. Please check out the YouTube channel. It's also called GYN Corner. And hit the like button, thumbs up button, and hit the subscribe button on YouTube to get a heads up notification on the presentations. And if you enjoy podcasts, we're on 8 different platforms for the podcast. It's also GYN Corner, and the podcasts are the usual haunts: Google Podcasts, Apple Podcasts, Apple iTunes, I guess, Spotify, Anchor, Podcast Addict, whole bunch of them. And then if you're in the tri-state area, New York City, New Jersey, and Connecticut, please come on by the office. We're by appointments predominantly, but I do have walk-in hours every day that we have office hours. I allow walk-in hours for urgent problems, infections, pain, those kinds of things. They don't need to wait a long time. Just call the office in the morning and the girls will give you the walk-in hours every day. And I hope everyone has a great rest of the day. This is Dr. McDaniel at GYN Corner. Bye.